Good afternoon, everyone. Welcome to LUMP TCM and Acupuncture Basics. Let's start the ball rolling with the first presentation. Let's welcome Sir Dino Pinheiro from Legazpi. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Continuation po tayo sa Shui, Blood, Part 11. Okay, this is the case of a female, 38 years old. Yung tongue description is pale, thin, curled up edges. So, observe po natin yung tongue pataas with a reddish center, yung sa gitna, and there is a depression at the root. So, kung observe po natin yung likod ng tongue, may palubog po na depression. Yung symptoms, there is a deep exhaustion, may burning around the anus, may anal pain, there is a constipation, lack of appetite, and insomnia. So, Western diagnosis, inflamed hemorrhoids. Yung background to disease, there is a strong demand at work and home, unhappy marriage, there's a constant prostration, may 4 pregnancies, caffeine abuse. Sa TCM diagnosis, there is a spleen Qi deficiency, blood deficiency, there's a liver Qi constraint, heat in the stomach, and essence deficiency. Next, we have a female, 35 years old. Yung tongue patient is pale with and thin. There is pale edges. Okay, manipis po yung tongue niya. There is a slightly dry and thin crack in the center. So, observe po natin yung tongue. There is a thin crack yung sa gitna po. Yung symptoms, there is exhaustion. There is acute diarrhea with blood and mucus. Ang patient merong hair loss. There is a short menstrual cycle and meron siyang intense fears. So, Western diagnosis, ulcerative colitis. Yung background to disease, there is helminths, improperly treated in India. There is emotional problems, vegetarian diet, and fasting po siya. Sa TCM diagnosis, there is slight spleen Qi deficiency, yung meron siyang blood deficiency, liver blood deficiency, slight stomach yin deficiency. Potential signs of blood deficiency, ang patient merong pale lips, yung nails, yung tongue, face. There's also dry facial skin and dry skin. Yung hair nag-fall out. There is floaters in the eyes. Merong body aches, numbness, and weak tendons that are easily injured. There's potential signs of blood deficiency. There is also dizziness, poor memory, difficulty focusing, depression, there is anxiety, difficulty relaxing, easily stressed, difficulty falling and or staying asleep, a feeling of floating, and disembodiment. There is also lack of strength, upper body tension, really heavy periods or light periods, merong headaches, may migraine. Sa Western illness group under blood deficiency, there is a chronic fatigue syndrome, may infertility, there is arthritis, anemia, eating disorders, restless leg syndrome, merong migraine, headaches, gynecological problem, may fibroids, menstrual problems, and pain, polycystic ovary syndrome. There's also problem with focus and concentration, being scattered, poor short-term memory, there's musculoskeletal pain, there's weak, mushy muscle tone, cold limbs, meron din siyang insomnia, depression, and anxiety. So, thank you po for listening.
Thank you very much, Sir Dino. Up next is pathogenic factors. Let's welcome, straight from Rizal, Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon, Dr. Hector. Good afternoon, everyone. Now let's continue our lesson on climatic pathogenic factors, which we started yesterday. One of the first pathogenic factor na take up po natin ngayon is the summer heat. This factor affects mostly the organs of the fire element kasi heat po siya. So the heart and small intestine is mostly affected. Okay. Now in our first tower diagram, the yin here is at a normal state, while the yang is in an excess state. So, meaning it is acute resent state. So, exterior climatic factor attacks the body. So, there is a feeling of hot, red skin, restless, tachycardia, colicky pain in center and lower abdomen. So, treatment po natin dito is to sedate the yang. Okay? The next tower diagram, the yin here is both the yin and yang are in excess state. So meaning acute reactive state body resistance reacts with yin. So there is a feeling of hot and sweating much, feeling sleepy in hot weather, and watery stools. Treatment po dito is sedate yang. Okay po? Then third tower diagram, the yin now is in deficient state while the yang is at an excess state. So meaning this is a subacute state. So meaning the illness is already from 31 days to 6 months in the body. So exterior heat consumes yin. So there is feeling hot with less sweat, mental exhaustion, restless sleep, and rapid heart rate, and sensitive small intestine. So treatment po natin dito is to sedate yang and tonify yin. Okay? Then the last tower diagram, the yin here is still deficient while the yang is already at a normal state. So meaning chronic state in the interior. So the sickness is now 6 months over. Okay? So yin is exhausted. So symptoms are chronic insomnia, very little sweat, hot flashes, and red cheeks from time to time. This chronic picture may change into hyperactive yang from time to time because yin could no longer control the yang because exhausted na po siya. So proper treatment po dito is to tonify the yin. Okay po? There may be heat symptoms in any organ system. Heat symptoms are ascending, dispersing, and accelerating in nature. For example, acid reflux and gastritis, urticaria, and tachycardia. Local treatments are bleeding, electrical stimulation, and cooling. Now we have here heat examples. Hyperactivity of heart yang. In our first tower diagram, the yin is deficient while yang is at a normal state. And then the second diagram, yin is still deficient and then yang is already in an excess state. So there is slightly increased body temperature, concentrated sweat, hot palms, smaller flush, rapid pulse with paroxysmal tachycardia, dream disturbed sleep, and stammering. Now, treatment is to use heart 5, which is the low connecting point, SI4, the U1 source point or sedation, then kidney 7 tonifies kidney yin, and Do20 for calming. Heart 5, the low connecting point, and SI4 sedation balance the yin and yang. Point kidney 7 tonifies kidney yin, then this increases storage of water in the body, which helps to control the fire in the heart. Point 220 is a tranquilizing point. This is a good method to slow down the metabolism, thus reducing the heat. Okay. Now let's go to the next example, dump heat in the stomach. Here the tower diagram, as we can see, both yin and yang are in excess state, but yang is higher than yin. So symptoms are fullness and pain in the stomach, vomiting, food or acid reflux, preference for cold drinks, watery stools, hot hands and feet, red swollen eyelids, gingivitis, and foul breath. So treatment po dito ay puncture, stomach 34 for sedation. This is the C-cleft point, sedates organ in acute situation. Spleen 9, sedation, sedates yin. Pericardium 6, UB21, bleeding cup, which is the back tube of the stomach. In the preceding picture, we have dryness, but here the yin is full and excessive. To sedate yin, we use spleen 9, which is the coupled yin organ of the stomach. Bleeding helps to release the heat from the stomach and is aided by the suction of the cup. It is important that the patient does not eat during this excess state. Okay? Thanks for your attention.
Thank you very much, Ma'am Teresita. We now proceed to yin and yang relationships. This time we talk about contradiction. So let's go to tower diagrams again. So the first one that you see is a balance of the yin and yang. The second tower diagram, this is where you get to see the yang increasing if exposed to yang factors like heat, sun, spicy food, infection, and allergy. So eventually, the yin will have to react. So the healthy yin will increase in an attempt to control the excess yang. If the yang increases for any reason, a healthy yin will not accept this without opposition. It will always do something to control it. So the yin will increase as well, thus causing temporary state of excess in both energies, causing fluid and heat. The yin is released by the body in order to cool or control the heat. For example, sweating. So when there is heat, we sweat. And if there is gastroenteritis, we vomit and we have diarrhea. And if we have bronchitis, there is excessive mucus. If we have joint inflammations, there will be edema or effusions. So treatment, sedate the yang only. It is enough to sedate only the yang. One could also support the yin. Even in this case, where the yin is in excess, it is possible to support it so that the yin would not be consumed by the excess yang. So if you have been very attentive with Ma'am Teresita's discussion, eventually the yin will be consumed by the excess yang. So we can continue supporting the yin, no? In order for that not to happen. It is possible to increase and decrease energies with acupuncture. There are points on meridians and therapy techniques for tonification or increasing energy and for sedation. So when you say sedation, we decrease the energy. It is possible to influence only the yang or only the yin. In this case, we reduce only the yang because this is the cause of the disease. Increase of the yin in this example is only a reaction to the yang increase. If we reduce the yang, the yin or the dampness should go down automatically. Let's go to another example. So the first tower diagram, of course, is the balance of the yin and yang. The second one, the yin increases. So this time it's the yin that increases because of exposure to yin factors like cold, damp, lot of fatty foods, raw foods, and closed, stuffy environment. So eventually, the yang will have to react. The yang increases to fight the yin excess. If the yin increases for any reason, the yang will react to this by rising up to oppose and control the yin. So this will again cause a damp heat situation. Okay, so this is heat caused because of dampness. So because of dampness, there is heat. Examples for this situation would be inflamed acne. Too much yin, so there is heat. Varicose eczema, itching and bleeding psoriasis, recurrent symptoms of gastritis in an obese person. Being obese is yin. So the obese would usually have gastritis. So there are situations where the yin is excess, or there is stagnation of thick fluids or blood, such as an oily skin, edema in the legs because of varicose veins or circulation problems, obesity, and thick raised skin in psoriasis. These are conditions where there is more substance and retention of fluid with poor circulation, and where this stagnant dampness can generate heat. Dampness causes stagnation and pathogenic heat. Treatment: sedate only the yin. We can support the functional qi, no moxa, but use only the bakshu points. We can use the luo connecting point of the yang organ with local cupping therapy. Where the heat is severe, we may do bleeding. Some blood may be left. We can do bleeding. Thank you very much for your attention. Up next is the 5 elements. Let's welcome, once again, Sardino Pinheiro from Legazpi. He will continue his discussion on the 5 elements. Good afternoon, Sardino.
Good afternoon, Doc. Good afternoon po sa lahat. Now, we go to the fire element, part 2. Sa heart chi, ang mental activity, we have the highly intelligent. So sa heart, there is increase in chi. Sa mentally retarded or dull, there is decrease in chi. Sa good concentration, there is a good chi. Sa short-term concentration, there is decrease in blood, and poor concentration, decrease in chi, and decrease in blood. The heart function governs the quickness to learn and understand, whereas the heart yin and blood help to store and remember function. So, tandaan po natin sa heart function, there is quickness to learn and understanding, while sa heart yin and blood naman, ito yung pag-store and mag-remember ng information. If heart blood is deficient, memory is poor and becomes difficult to store information, even though the function could be good. Okay po. Sa heart blood, yung memory naman, if there's decreased memory short term, there is decrease also, it is because of the decrease in heart blood. Pag decrease ang memory sa long term, there is decreased kidney yin. Sa heart chi, sa creativity, increased creativity, extrovert, and confined, there is increase in chi. Pag decrease ang creativity, introvert, and lack confidence, there is a decrease in chi. Sa heart naman, sa pag-sleep, if there's acute insomnia, hot, and excited, there is increase in yang. Pag chronic insomnia, hot and excited, there is blood and yin deficiency and increase in yang. Pag chronic insomnia and cold and exhausted, ibig sabihin there is blood and yin deficiency and yang deficiency. Sa hyperinsomnia, there is decrease in qi, increase in yin. Heart nourishes blood and blood vessels. Heart synthesizes red blood and circulates it to the whole body. Anemia or blood deficiency is caused by heart blood and qi deficiency and causes liver blood deficiency. Blood deficiency can create other problems such as low blood pressure and low mental energy. Heart circulates blood and heat. Heart secretes sweat. As the heart is a central circulating organ, problems with heart function will create temperature changes in the central and upper body and hands, but not necessarily in feet. Sweating is the body mechanism to cool itself if the temperature is too high. Though the climatic factor that promotes sweating is associated with the heart, the actual function of opening the skin and releasing sweat is that of the lungs. So we have here excessive heat in the whole body, yung thorax, face, and hands. Ibig sabihin, there is increasing yang in the heart. Pag excessive heat naman, excessive sweating, there is increasing yang, increasing yin in the heart. Excessive heat with concentrated sweat, increase naman yung yang, there is a decrease in yin in the heart. Cold in body, thorax, and hands, ibig sabihin there is decrease in yang in the heart. Pag cold but excessive sweating in the same areas, decrease yang and yin, and yung lung qi decrease din. Ibig sabihin there is a leakage. Yung leakage, when heart yang is deficient, we should not sweat as we will become colder. So pag bawas na yung heart yang, hindi dapat magpawis kasi mas lalamig. Here, release of yin is not for cooling the body, which is already cold, but a sign that the yang cannot hold the yin in any longer. This is called a leakage, a deficiency of both. And it is also a functional qi deficiency of the lung, because it is the task of the skin to open and close effectively. And in this case, the skin pores are open in spite of the body being cold. Okay po. So thank you po for listening.
Thank you very much, Sir Dino. Up next is Jing Essence. We listen once again to Ma'am Teresita Sumile. Good afternoon po, Ma'am Teresita.
Good afternoon ulit, Dr. Hector and classmates. Let's continue our lesson on Jing or Essence, which we started yesterday. Okay po? Jing or Essence is responsible for essential immaterial or soul and essential physical being or body of a person. Yin, nature, and it is stored in the kidneys. It is the densest physical matter within body. It circulates through 8 major vessels where it helps to create semen, menstrual blood, and bone marrow. Jing Essence regulates growth and development, works with qi to help protect body from harmful external factors. Jing plus qi equals foundation for Shen or spirit. Jing is usually translated as essence, used in 3 different contexts with slightly different meanings. pre-heaven or prenatal essence, post-heaven or postnatal essence, and the essence or kidney essence. Now, pre-heaven essence determines each person's basic constitutional makeup. Strength and vitality can be influenced only with difficulty in the course of adult life. Post-heaven essence is a general term to indicate the essences produced by the stomach and spleen after birth, as opposed to the pre-heaven essence which is formed before birth. The essence or Aka kidney essence derives from both the pre-heaven and post-heaven essence. It interacts with the post-heaven essence and is replenished by it. It also determines growth, reproduction, development, sexual maturation, conception, and pregnancy. Now let's go to the functions of essence. Basis for growth, reproduction, and development. Controls the growth of bones in children, teeth, hair, normal brain development, and sexual maturation. It is the basis of kidney chi, and it produces marrow, and also the basis of constitutional strength. Now let's go to the observation in TCM. Kidney essence shows in hair, teeth, bone structure, and ears. So the picture of a woman here is a picture of a woman with great kidney essence. So, and the picture of a man here shows that his kidney essence is not so great. So see the difference. Okay. Now we have three types of essence: the pre-heaven essence, post-heaven essence, and the kidney essence. Pre-heaven essence conception is a blending of sexual energies of man and woman to form pre-heaven essence or prenatal essence of newly conceived human being. Pre-heaven essence nourishes embryo and fetus during pregnancy, dependent on nourishment derived from mother's kidneys, and only kind of essence present in fetus as it does not have independent physiological activity. It determines each person's basic constitutional makeup, strength, and vitality. It is what makes each individual unique. And it is closely linked to far of great of life or Ming. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We will now talk about Zangfu organs. We shall continue with spleen pathology, where we left off last time. Spleen qi sinking. This is a sub-pattern of spleen yang deficiency. In spleen qi sinking, the spleen function to hold organs in place is impaired. Cardinal symptoms will include symptoms of spleen qi deficiency and spleen yang deficiency, plus organ prolapse. This can be the uterus, bladder, rectum, stomach. Pushing downward feeling, hemorrhoids, varicose veins. Spleen not controlling blood. This is also a sub-pattern of spleen yang deficiency, in which the spleen function to hold blood in vessels is impaired, so bleeding occurs. Bleeding can also be caused by heat in the blood. Cardinal symptoms of spleen not controlling blood: purpura, blood in stool, blood in urine, melena, menorrhagia, uterine bleeding. All symptoms only in combination with symptoms of spleen qi deficiency or spleen yang deficiency. Purpura, blood in stool, blood in urine, melena, menorrhagia, uterine bleeding. The bleeding disorders originate because spleen is not able to hold blood in the vessels. Damp cold in the spleen. This is a further development and complication of spleen yang deficiency. Spleen yang is unable to transform food, and dampness is produced. Dampness impairs movement of qi, and this can manifest in a feeling of constriction. Qi is unable to rise to the head, and the feeling of heaviness manifests in the head. Cardinal symptoms: symptoms of spleen qi deficiency and spleen yang deficiency. Additional symptoms: loss of taste, feeling of heaviness in the head, feeling of heaviness in extremities, weariness, edema, crust around the eyes, vaginal discharge, cloudy urine. Damp heat in the spleen. Damp heat in the spleen is further development and complication of yin deficiency. So this is sourced from yin deficiency. Yin deficiency leads to heat or empty heat, which causes the spirit to be restless. In order to compensate for restlessness, the patient may eat dampness-producing foods, and damp heat in the spleen is the result. Okay? So, see the scenario. Yin deficiency will lead to heat, and because of the heat, this will make your Shen or your spirit restless, so there will be craving. So, person may eat damp-producing food, and so, as a result, you can have damp heat. Okay? So that is the pathology of damp heat, or the pathogenesis of damp heat in the spleen. So cardinal symptoms: feeling of heaviness, soft, strong-smelling stool or constipation, abdominal pain, patient feels thirsty without desire to drink, thick yellow tongue coating, feeling of belt around the body, duodenal ulcer, ventricular ulcer, feeling of heaviness in the head, and helmet-like headaches. So helmet-like headaches is definitely damp heat in the spleen. Thank you very much for your attention. Up next is meridian theory, to be presented once again by Sir Dino Pinheiro from Legazpi. Good afternoon, Sir Dino, once again.
Good afternoon, Doc. Good afternoon po sa lahat. Okay, continuation po sa meridian theory, stomach channel of the foot yang min, part 2. Okay, we have the stomach 21. If we observe po dito sa my picture, nasa may gitna po siya between the umbilicus and the sa my chest. Location, 2 chun lateral to the anterior midline. So we have 2 chun paside and 4 chun above the umbilicus, or 4 chun below the subcostal angle. So in between these two lang po ang pagsukat. The point explanation, this point is either side of REN 12. So nasa side po, etong gitna din is location ng REN 12, which is the influential point of the stomach. It is mostly used to enhance the local effect of on the stomach, especially if the pain or discomfort area is largely around REN 12. Stomach 25 is located 2 chun lateral to the umbilicus. Yung point explanation, it is the front point of the large intestine. This point is used for almost all problem of the large intestine. For example, yung diarrhea, constipation, or abdominal distension. In severe constipation, electrical stimulation can be used on the points. So, dito po yung picture, 2 chun lateral dito sa may umbilicus. Next point, we have stomach 27. Yung location is 2 tune below the umbilicus. Okay, pababa. And 2 tune naman lateral to the anterior midline. So, puro 2 lang po. Puro 2 tune. Makukuha natin yung stomach 27. This is used in abdominal colic in children. When used in children, pwede po i-pinch. Yung points 3 to 5 times is preferred kung hindi po magdinidling. Sa next point, stomach 29, which is located 1 tune above the upper border of the pubic symphysis. So pataas po, 1 tune pataas, and 4 tune below the umbilicus. Kung susukatin naman from the umbilicus, 4 tune siya pababa. And 2 tune lateral to the anterior midline. Besides 2 tune. Ito pong point is used as a local point for the reproductive organs and bladder problems such as infertility and irritable bladder. Yung needles should be given at a 30 degrees angle in a line parallel to the inguinal groove. Okay, next, stomach 31, stomach 32. Yung location, it is in stomach 31 is inferior to the anterior superior iliac spine, lateral to the sartorius muscle at the level of the lower border of the pubic symphysis. So, tingnan po natin dito sa may picture. Stomach 32 on the thigh, dito naman sa may baba. On a line connecting the lateral patellar border and the anterior superior iliac spine. It is 6 tune superior to the upper lateral border of the patella. Okay, dalawang 3-3. So makukuha natin yung stomach 32 from the patella. Ang point explanation, these points are located proximal to the knee, on thigh, and on the quadricep muscle. They are very useful in the treatment of hip and knee problem where the legs become weak. These points strengthen the legs, enabling patient to get up more easily for low seats, take longer strides, and use stairs better. The needle should be given deep and well into the muscle, ideally with patient lying down. Next, we have stomach 34, yung location on the line joining the lateral patellar border and the anterior superior iliac spine. 2 tune proximal to the lateral border of the patella. So pataas, it is 2 tune from the lateral border of the patella. And in a group of vastus lateralis muscle. So makikita po natin sa picture, yung dalawang thumb from the lateral side ng patella pataas is the stomach 34. This point is a C-cleft point of the stomach. This point is used with sedation technique for problems such as acute stomach pain, gastritis, and herpes labialis. Okay, next we have the stomach 36, which is located through 3 tune lateral to the stomach 35, or yung lateral eye of the knee, and 1 finger breadth lateral to the anterior crest of the tibia on the tibialis anterior muscle. Itong point is easily the most important point on the meridian. It can be said that as this is the earth point of the earth meridian, this point is like our connection to the Mother Earth. I would never sedate this point, sabi niya. As for me, it would mean as if one was removing the earth from under the feet. So hindi po siya sinesedate, pwede po i-tonify. The use of this point is tremendous. It gives one stability of body and mind, improves digestion, and general energy. It provides power to the legs and increased well-being of the abdomen. Next is stomach 37. It is located 6 tune distal to stomach 35. at the knee joint space, or 3 tune distal to stomach 36. So pababa ng stomach 36, 3 tune. And 1 finger breadth lateral to the anterior crest of the tibia. Itong point is called the lower C point of the large intestine and is used for all problems of the organ. The C point of the large intestine is point large LI11, but at the superficial meridian does not flow on its organ as most of the other meridian do. The large intestine has an additional C point on a meridian that does not flow on its organ, yung stomach meridian. This is an excellent point for treating intestinal colic or diarrhea. Next point is stomach 38, which is located at the midpoint of the line joining stomach 35 and stomach 41, and 1 finger breadth lateral to the anterior crest of the tibia. So kung makuha natin yung stomach 35, which is sa lateral side ng inferior lateral side ng patella, and dun naman sa may harap ng ankle joint, yung stomach 41, i-join lang po natin, and yung gitna nun is the stomach 38, which is 1 finger breadth lateral to the anterior crest. Itong point is a very effective point in the treatment of shoulder pain. So ginagamit po natin siya sa may shoulder pain. I believe, sabi ng author, the reason that this point has been chosen and not stomach 36, although the latter is an even stronger point, is because stomach 38 is not a standard energy balancing point. So it is quite safe to sedate this point. So ito po mas ginagamit dahil pwede mo siyang i-sedate or i-reduce, unlike nung stomach 36 na for tonification lang po siya. Stomach 38, the point has to be continuously sedated at least for 2 minutes. So 2 minutes po siya is sedate, whereas sedation of stomach 36 would cause other problems such as weakness of legs, numbness of feet, and inability to digest food for some time after the treatment. So hindi po recommended na mag-sedate ng stomach 36. This point, yung stomach 38, is especially effective in anterior shoulder pain. So sa harap po ng shoulder na masakit, maganda po gamitin ang stomach 38. So tandaan po natin yan. Shoulder pain caused by dysfunction of the large intestine meridian. When locating stomach 38 at any point which is more than 3 tune away from the anatomical landmark, the appropriate distance should be considered as opposed to the finger breadths, as the tune measurement depend on finger breadth, which varies with age and arthritis, and will vary if the patient is a manual worker or a person of leisure. The more fingers used, the farther the point would be. So stomach 38 should be measured at the midpoint of the line drawn between stomach 35 or lower border of the patella and stomach 41 at the dorsal foot fold, and 1 index finger breadth lateral to anterior crest of the tibia. So mas maganda daw gamitin yung pagkuha nung kung alin yung gitna kaysa gamitin natin yung fingers pag-measure. Okay po. Thank you for your attention.
Thank you very much, Sir Dino. We now come to the last but not the least topic, breathlessness. We will continue discussing the patterns. Wind cold on the exterior and phlegm fluids in the interior. Clinical manifestations, aversion to cold, fever, shivering, headache, no sweating, breathlessness. So there is cough with profuse white watery sputum, difficulty in lying down, swelling of the limbs. The tongue, sticky white coating. Pulse floating. This corresponds to invasion of exterior wind cold in a person who has already a pre-existing condition of phlegm fluids in the interior. So this is a situation of an acute exacerbation of chronic breathlessness. Phlegm fluids usually occur only in the elderly. Besides the typical symptoms and signs of exterior invasion, which are aversion to cold, shivering, fever, headache, nose sweating, and floating pulse, there are symptoms of retention of phlegm fluids in the interior, like breathlessness, cough with expectoration of profuse white watery sputum and sticky tongue coating. Swelling of the limbs is due to phlegm fluids retained subcutaneously. The person finds it difficult to lie down because phlegm fluids stagnate in the chest. Treatment principle: release exterior, expel wind cold, restore descending of lung qi, resolve phlegm. Now let's go to the points used. Lung 7, lung 6, lung 5, bladder 12, bladder 13, Ding Chuan extra point, pericardium 6, stomach 40, Ren 22. All points are needled with reducing or even method. Lung 7 releases exterior and expels wind cold. Lung 6, which is an accumulation point or she cleft point, relieves breathlessness. Lung 5 resolves phlegm from the lungs. Bladder 12 and bladder 13, with cupping, with or without needling, release the exterior. Ding Chuan stops acute breathlessness. Pericardium 6 opens the chest, relieves a feeling of oppression of the chest, and helps breathing. Stomach 40 resolves phlegm and opens the chest. Ren 22 stimulates descending of lung qi and resolves phlegm. Now let's go cold on the exterior, heat in the interior. Clinical manifestations: breathlessness, distension of pain in the chest, coarse breathing, runny nose, cough, vomiting of sticky phlegm, feeling of heat, cold limbs, irritability, aches, and thirst. Tongue is red, coating white or yellow. Pulse is slippery, rapid. This corresponds to the second stage of wind cold invasion, when wind cold is still on the exterior, but interior heat has already formed. Alternatively, it could occur in an invasion of wind cold in a person with a pre-existing condition of interior heat. So it can therefore be either an acute attack of breathlessness or an acute exacerbation of chronic breathlessness precipitated by wind cold invasion on a background of interior lung heat. There are some symptoms of cold on the exterior: cold limbs, aches and runny nose, and some of the interior heat of the lungs, such as irritability, feeling of heat, coarse breathing, thirst, rapid pulse, red tongue. Treatment principle: clear heat, restore descending of lung qi. Points: lung 7, lung 6, lung 10, lung 5, lung 1, LI 11. All needled with reducing or even method. Lung 7 restores descending of lung qi. Lung 6, which is a she cleft point, relieves acute breathlessness. Lung 10 and lung 5 clear lung heat. Lung 1, which is the alarm point or front mu point, clears lung heat, relieves fullness of the chest, and stops breathlessness. And LI 11 clears heat. Thank you very much for your attention and hope to see you next time. Good afternoon, everyone.